Hello everyone, welcome again to our writing task. Here we will have another one OET letter. Today we are going to write the letter to uh, patients, family, maternal and child health nurse. That means this is a non-case because this is patients, family, child health nurse. So this will comes under the non-case. So let us see the writing task. You are the charge nurse on duty at the children's hospital. You have been caring for this patient and an infant. Patient details are name Anne Ballard, age 22 months. Next of kin Christine Ballard. This is her mother. Admission date is 16 March 2010. Discharge date is 22 March 2010. Diagnosis second degree burns to right trunk and arm following accidental scalding with hot water. Family and social background mother and 4-year-old brother, his name is Tom. Mother is 28 years, separated from husband 4 months ago. Financial difficulties following separation. Housing, 3-bedroomed house in new housing development. Family reliant on public transport, socially isolated because Christine's parents interstate has only few friends. There is a query about her mother's mental status, whether it is depressed or no. Children spend alternate weekends with father. Medical history and medications. Nil medications, nil significant history, no non allergies. So here is some specification how to notify it. As I told, this is a non-case letter. So here there is no specification for social background and medical history, including this past allergies. So these all are irrelevant data for us. Management and progress during hospital stay. 2 times daily Silvadin dressing to affected area, IV fluids for 24 hours post admission, and then oral fluids. Mother referred to hospital social worker. Medication, prophylactic antibiotic cover, and analgesia. So these are relevant data. We should write it in our letter. And the discharge plan. These all discharge plan will come under our recommendation paragraph. Daily Silvadin dressings, no discharge medications, monitor mother's mental state, introduce to local support like mother's group or activities as well as local child care center, etc. Make appointment with the local financial counselor for financial problems. So these are all the discharge plan. And let us see the writing task. Using the information given in the case note, ask the charge nurse on duty write a letter to the family's local maternal and child health nurse. So from here we can find out this is a non-case of letter. Outlining relevant information and requesting follow up on discharge. Address a letter to Greenville Maternal Child Health Center, Main Road, Greenville. So this is the question. So in this question, we can mark something like patient name, age, admission date, discharge date. These all you have to mark it while preparation to write the exam, exactly the before writing letter. And the diagnosis is important because still patient have burns, second degree burns to the trunk, right trunk and arm, and following accidental scalding with hot water. This is the thing what we are going to write it in the present medical history. Family history no need, and the management we should have in mind. We can keep tick or underline the all the management and the discharge plan. We should have importance for daily Silvadin dressing. So when you will go for tick or underline the discharge plan, after tick here daily Silvadin dressing should be there. Monitor mother's mental state, introduce to local support, make appointment. No need for this no discharge medication thing is to be written. Here we have to concentrate according to the priority. The first one, daily Silvadin dressing for the baby. Second one, monitors mother's mental health and introduce to local support. And make an appointment with the local financial counsellors. In this letter, there is nothing to be think about much regarding the recommendation because it's according to the priority. But in some letter, you cannot expect that it will be in order. It will be somewhere else. So you have to organize first with the number 1, 2, 3, 4 like that. Then you can start writing. So let us see the writing format. So first one we will write with the date. So discharge date will be for the exam. There is nothing to be worried. Mostly 99 percentage. Your exam date will be the letter date. So here we can write discharge date 22 March 2010 and the address the Maternal and Child Health Nurse, Greenville Maternal and Child Health Center, Main Road, Greenville. Salutation, dear nurse. There is no comma regarding patient full name. So here this is baby. So here we can just write and Ballard, comma, aged 22 months. Then we will go to the introduction paragraph. This is non-case of letter. So the format of introduction will be different than other type of letter. So this is a format. I am updating you the current health status of Anne Ballard who has second degree burn. She requires an ongoing care. She is said to be transferred back into your care today. So here, two things you have to keep it in your mind. This is the fixed format for noun case. That is, I am updating you the current health status of patient name and condition. That means recent present medical condition. And the last discharge status should be she or he is said to be transferred back into your care. That means we are referring back into the patients, the GP or the child health nurse or whatever the person who is related to the family or the patient. So I am updating you the current health status of Anne Ballard who has second degree burn and she requires an ongoing care. She is said to be transferred back into your care today. Hope it is clear for you. Next, we will go to the present medical history. So here we will just write at the time of admission until now what all the things we did for the patient. And here for babies, actually the first name we have to write, not Ballard, should be Anne. Anne was admitted on 16 March 2010 with burns on right trunk and arm following an accidental scalding with hot water. We just copy paste from the writing task because it's given directly. Then what we did later on? Her wound was managed with daily Silvacin dressing. Her hydration status was maintained with intravenous fluid therapy for 24 hours, followed with oral fluids. In addition, she was commenced on prophylactic antibiotic as well as analgesics. So, here is nothing to be explained much exactly what they have given. There is only limited managements. So, according to the priority, we can write. So, the first one, everything should be in the passive voice. That means her wound was managed with the daily dressing. Her hydration status was maintained with intravenous fluid therapy for 24 hours. Then later on with the oral fluids. You can write some connectives like in addition, because we could not write moreover. Furthermore, these connectives are not allowed now in OET. So you can write additionally or in addition. She was commenced on prophylactic antibiotic as well as analgesic. So this is for present medical history paragraph. Next, let us see the recommendation paragraph, because this is the changes what you have to mind during writing for a non-case, because here no need to write any social history paragraph, no medical history, no past surgical history. That completely that paragraph how to be avoided. So straight away we can go to the recommendation paragraph. So here we have already prioritized and we wrote the numbers in the question paper, right? So we can start writing like kindly note that Anne's burned area needs to be dressed daily with the Silvacin. Please arrange an appointment with the local financial counselor since they have financial problem. It would be appreciated if you could assess her mother's mental status and introduce to local support groups such as Mothers Group or local childhood center. So according to the priority, we have written here the first thing is for baby, the dress regarding the dressing. Second one, there should be an arrangement appointment for the local financial counselor since they have financial problem. And the third one, we are asking some additional help for the mother. So we can use the connective. It would be appreciated if you could assess her mother's mental status and introduce to local support group. group such as so and so. So this is the recommendation paragraph, and maximum please try to add some connectives so that the letter will be good to see. And the conclusion paragraph you can write, please contact with me if you have any queries. Please do not hesitate to contact with me if you have any queries. And yours faithfully, Chastness, because here the reader name is not given, so you can write yours faithfully, not yours sincerely, Chastness. So this is what in the writing letter. So for the noun case, please try to keep it in your mind. There is something special things are there in introduction, and there is no need for social history. So in the introduction, there should be I am updating you the current health status of patient name and with the condition, and he or she is said to be transferred back into your care today. So that specification should be there. Then no need to write any social history or any past medical or surgical histories. No need to write anything. And in the recommendation paragraph, just prioritize the interventions and just write it in the order, write it in an order according to the priority. You can write it, it's like a order. And if there is no reader name, don't forget to write yours faithfully rather than yours sincerely. So that's all regarding this letter. I hope it was helpful for you all, and which was easy. I hope it was easy. So please try to write in this same manner. Okay, thank you for watching. We will see with that another one writing task.